It's the Power Psychology Show. Find your joy again with Brittany Meredith. How are you doing today, Brittany?
I'm doing very well. How are you?
Very good, very good. So, what's the update? How's it going with the office?
Yeah, things are going pretty well. Going pretty steady, I think, for most people. Things have picked up. We had a little bit of a dwell for a while when all this COVID stuff hit, and now people are seeking help out a bit more. And there's lots of people who are hoping to get back to in-person therapy, face-to-face work. So we've started to do that more and more. Our therapists are transitioning back to that on a case-by-case basis. And then we, of course, still have the option for virtual therapy available for those who want to continue that way.
And how have you found the responses from the community? For people in a reflective and transparent enough, honest position that you're seeing more people that need help reaching out?
Yeah, I think we're starting to see more people as time goes on, right? People are getting more lonely and anxious about wanting to get out and live their lives like they usually do, right? So, yes, yeah,
That's good.
probably going to continue to pick up, I think.
That's good. That's good because the service is there and it's there to help. So, well, we have a topic today for your first show. So thank you. The Power Psychology Find Your Joy Again show here on TVU. We're very appreciative. And we're going to revisit a topic again that we touched on in original COVID interviews, and that was body-focused repetitive behaviors.
Mm-hmm.
So, share.
Yeah, so like you said, we had touched very briefly on this topic last time as an area that I specialize in. And just given really the lack of knowledge around it, the lack of supports for people who are struggling with these disorders, I want to kind of give it some space and talk a bit about it. So there's a lot of therapists out there, a lot of medical professionals in general that have no idea what it is, what these disorders are, let alone how to treat them. And especially right now, with people being more isolated and struggling with anxiety and grief and this kind of thing, of course, any kind of mental health situation is escalated. And so these behaviors are escalated as well in a lot of cases.
So, obviously you've you feel need to speak of it. So then people are finding themselves in it. Let's talk about the people that are, we'll talk about intervention first because, we'll deal with that secondarily because I think intervention isn't necessarily the right perspective. So a person who's in that spot, I don't understand it. It's hard for me to grasp. Yeah. So, what are they dealing with? It's a private thing, so, and how can you shed some light on that?
Yeah, there's a lot of shame around these behaviors. So, like we said, we mentioned it last time, but let's just clarify what exactly we're talking about here, right? Is hair pulling disorders, skin picking, severe nail biting, severe nose picking, and severe cheek biting kind of stuff. So, yeah, there's a lot of shame around these behaviors. There's a lot of trying to hide these behaviors from other people. So when we're isolated at home, it becomes harder and harder to hide these behaviors from our loved ones, right? When nobody really has much to keep them busy, they might be wondering why you've been in the bathroom for a couple hours doing whatever you're doing in there, right?
So then where does someone decide? It's kind of tough for the youngsters, but so let's say people are carrying this into, we're talking about 17-year-old people and older now, up to 100, right? Where can people, catch themselves in a moment of clarity to want to get help, and what do they deal with before, other than shame? Because shame and humiliation are, often they're self-inflicted often, right? So how can they unwind that and move towards the right mindset to reach out for help?
I mean, they are self-inflicted, but at the same time, these behaviors lead to people, having hair loss or not having eyebrows or eyelashes. So it becomes quite visible, and sometimes they are shamed publicly in various ways, whether it's intentional or not, right? So I think it's important to acknowledge that. And I've even had people come to me with really negative experiences they've had with other therapists or with doctors who don't know what these disorders are, making very shameful comments as well, like that's gross, or that kind of attitude around it. And I think it's important to acknowledge that. Can you repeat that first part of that question again?
Well, it's just, the kind of the behavior that we all do. It's these are obsessive habits. So we all have habits. So how do we deal with habits? How do we try to unprogram a habit? So usually we end up spun around and convincing ourselves to continue with the habit, right? So now we're in an obsessive, extreme, damaging habit, which now so we're as friends and families and work associates, we can't even get over our own habits. But now we see someone has a habit, or they see themselves that has a habit. There has to be a few self-help steps that they need to take. You can't drag people in to see you, right? They have to decide to see you. So so if someone's watching this and they have one of these things, what are the kind of things that you can help with that decision to get help, right?
Mm-hmm. Yeah, so like you said, it is a habit, and they are habits that everybody engages in to some degree. But when it's really interfering with your social and occupational functioning, then that's a greater degree of severity that kind of needs to be addressed, right? Questions are always
the help. How do they, what are they dealing with? What is someone who has this kind of obsessive habit? What kind of decision-making process? What's blocking them from wanting to get help? Like I'm saying, anybody, you know what I mean? Like,
yeah. So what I was going to say about that is that the way that I view it in a lot of ways is kind of like an addiction, right? So like other addictions, you have to recognize first that it's a problem. Mm-hmm. Right, so that can be more difficult with different age groups, right? Like children are less likely to recognize right away that something is a problem because it's not a problem for them necessarily yet. As they get older, it becomes more and more of a problem.
Mm-hmm. Mm-hmm. So they're kind of trapped in that problem, right? They're cornered by it.
Yeah, and people are at different stages of change, like they are with any kind of addiction, right? So kind of moving them further into into those stages of change as to, what's less desirable about these behaviors, or why might you want to change these behaviors if you do want to, and how can we help you navigate that, right?
Okay. So it's the way out is recognizing behavior and deciding which behavior you want. So now we're dealing with the strength of decision, right? Where decision moves from being choice to resolve. So how someone how can we move from choice to resolve? How can we just say I'm going to do it?
Yeah, we have to recognize everything that goes into these behaviors. So it's not just that it's happening for no reason. I don't think anything happens for no reason. You have to recognize what are the thoughts associated with it, what are the emotions associated with it, what are the body sensations, how much urge do I have to engage in this behavior? What can I do to help myself? There's various aspects of it that have to be recognized.
So then it's not necessarily the intellectual recognition of it can actually be in dealing with habit, in this case obsessive habit. Mm-hmm. It seems to me that the highest ground that someone could get, other than going in and dealing with a professional on help, would be just resting out a sort of an intellectual supremacy over the emotions and physical impulses that are wanting to force that habit just in that moment, to say, okay, logically this is what I want to do, because what you described, there seems to be an undercurrent that maybe some sort of functioning that's is just now your body is wanting to do things that now creates an emotional atmosphere that sort of drowns out your critical mind. I don't know, am I off or is that close?
No, I think you're pretty close. I think for most people it's a coping tool, right? That they're using it to satisfy something and they're just not aware of what exactly it's there for.
Mm.
And getting to know that more and more, and then using different types of therapy to address kind of where it came from, and how do we move forward without it, right?
So there is hope. You're talking that, things in people's, it could be a physiological precondition, but um, unlearned behavior kind of, however that really, can be, specific, or events, that occurred to people, or maybe a series of events. And this is what this um, body focused repetitive behavior. Do you identify those past events, or just become conscious that something like that exists? What's that process?
Yeah, that's a good question. So, for example, if we're doing what I do in my work is like EMDR and hypnosis, right? So if we're using those types of therapy, yeah, you are going to identify most of the time what these original events are that have contributed to that, right? There is a genetic component as well in a lot of cases. In research, there has been identified a genetic component, so that could be a part of it as well. Just kind of this nature and nurture mix.
So then, people would in many, this kind of, even though I think body focused repetitive behavior is so, it would be very fascinating in terms of, on the clinical side, and probably very illuminating in other human behaviors. And then using hypnosis to, in a sense, go back, through, a person's memories, I guess, and the however memory is contained. But memory is very powerful. It's a complete memory. It's just not just a sort of a picture memory. There's sound, sense, vibration, everything, tastes, everything. So when you get to these events, or these conditions in hypnosis, there must be great relief for people when they come out, and
Yeah, absolutely.
and then that would help them in other areas of their life. I imagine they breathe better. I don't know.
Yeah, no, absolutely. And in EMDR too, right? And we're always trying to move towards healing. We just have to facilitate doing so sometimes. And sometimes that takes another person's help to get there.
So, and then that would be, especially related to a lot of the anxiety issues, a lot of human malady that would be at other health care practitioners. They're at the clinic, looking because their body's aching, right?
Yeah.
But certainly take care of that. But these kind of things, because, like you said, of the physiological memory, it's that's interesting. So any cautionary words, or any encouraging words? It's obviously it was on your mind, so you're seeing it as a general condition, not general, but it is apparent in the community. Anything that you'd like to say that to that?
Yeah, it's something that I work with quite often, right? So I mean, about 5% of people suffer with one of these disorders, so that's comparable to, for example, bipolar disorder, right? So it should be a lot more well known, I think. Cautionary words, I mean, just try and find somebody who knows. If you're seeking out treatment, for example, try and find somebody who's familiar with these disorders. It doesn't always tie back to any particular event that's happened. There's lots of different reasons that people develop them. But so treatment then, of course, is tailored to the individual as well, which is always important with therapy, that one size doesn't fit all. Yeah.
Okay, that's treatment options.
Yeah, so I was mentioning that it's important to find a qualified treatment provider, somebody who's knowledgeable in this area. So there's an organization called the Canadian Body Focused Repetitive Behavior Support Network. Their website is canadianbfrb.org, and they can find different treatment providers and lots of other resources. Family members can find ways to support their loved ones, for example, or different types of treatment and that kind of thing.
That was awesome. What do you think?
Yeah, good.
That's good. Power Psychology, Find Your Joy Again with Brittany Meredith on the Health and Wellness Channel, TVU.
Perfect.